So my name is Sarah Kimball, and I'm a primary care doctor. I'm really a clinician first and foremost before I'm a researcher. But my research experience really comes out of my role as the director of the Immigrant and Refugee Health Center at Boston Medical Center. So I'm going to tell you a little about the IRHC with a particular focus on how we are using data and research to design, build, and really measure our interventions. And I just want to say that we really see our role as an equity-based program. We at the Immigrant Refugee Health Center don't believe there's any reason why immigrants should or need to be any less healthy than anyone else around them. And it's our mandate as a center to try and build interventions that eliminate the disparities that we see currently in our immigrant and refugee population. Next slide, please. So we all know the complexities of navigating our healthcare system. I think even for English language speakers, it is a tremendously complicated system. And until we replace it first with something a little saner, in my opinion, we see it as our job to help our patients navigate the healthcare system in all of its complexities. And we've done this by building one central point of entry through which any immigrant patient who has barriers to getting their healthcare needs that are related to their immigrant identity, we want to help them meet those needs. We have, through that work, really built two separate databases, one of which is a research database under IRB, and the other is an operational data set that's helping us understand our operational metrics. And I really see this research component as critical to helping us understand the equity issues that our patients are facing so that we can build our interventions in the clinic. Next slide, please. So this is quite a busy slide, but the reason I put it in here is because I want to give an example of how we are using data when we have our interventions. And as a clinician, often my job is to look and see the patient in front of me. But as the director of the center, having this kind of aggregate level data helps me understand what we need to do day to day in order to help reverse disparities. So you'll note that our patient population primarily comes from Africa and Latin America, and you can see the specific countries within that. And interestingly, we actually have a patient population that has fairly high levels of education comparatively, many of whom have graduated high school or college and above. You'll note also that many of our patients do not list their immigration status. That is on purpose. That is because it's really considered to be not safe for patients legally to have their medical records demonstrate their immigration status. So our model of being mixed within the medical setting and having healthcare data has its strengths because we get a lot of information about people's healthcare utilization and their social determinants needs, but we also can't put some information in there like their immigration status. Next slide, please. So I want to give one example of how this has worked before I tell you about the different projects that we would love to get some involvement in. So you can see from this, we built our single point of entry. Every patient who comes through our center gets a basic social determinants of health screener. And what we found out from that initial screening is that many of our patients, over a third, identified an immigration legal need as their #1 priority, which is interesting if you think about what your #1 priority is when you go to your doctor or your healthcare provider. So because of that, and because of the information we've gotten in working with collaborators around what the social determinant needs are in our patient population, we built an immigration legal program where we have a full-time navigator who's an AmeriCorps member, and we have a partnership with an immigration organization externally, RIAN Immigrant Center, and we are seeing patients, referring them to attorneys where they can actually be seen within the healthcare setting in a trusted space. And so that's the kind of example of how we are using the data that we collect in the course of our clinical care in order to build equity interventions. Last slide, please. So I put this up here as an example of the type of research that we are building out of the work that we're doing in these databases. And I hope that this is something that can be shared widely because we would really love to have both research collaborators and students. If there's projects that are of interest to you, we have a monthly research meeting. And I will just name that I really think a lot of the creative work coming out of our center is in helping understand some of the intersectional risks of being, for example, a migrant who has an insecure immigration status and having an LGBTQI identity. So we have research projects going on specifically looking at those challenges. We're looking at the challenges of learning disabilities as a migrant. So if you see anything on this slide that is of particular interest to you, consider this an open invitation to join our monthly research meeting. We'd be happy to have you learning with our group, and when there are project ideas, we're happy to have participants. Thank you so much for your time and for all of the experts here today.